Surveillance after colon cancer surgery. An in-depth look at post-surgical follow-up for colon cancer survivors. Welcome to today's episode, where we delve into one of the most vital aspects of colon cancer management: surveillance following surgery with curative intent. Whether you are a patient, a caregiver, or a healthcare professional, understanding the purpose and process of follow-up care is essential. Let's begin by exploring the core goals of surveillance after colon cancer surgery. First and foremost, the objective is to detect any recurrence, whether local or distant, as early as possible, when additional curative treatments, such as surgery or targeted therapies, may still be effective. Surveillance also aims to identify new cancers that may arise in the colon or rectum, which were not present during the initial treatment. Another crucial aspect is monitoring for long-term effects of surgery or the chemotherapy often administered after surgery. Surveillance visits provide a valuable opportunity to manage these effects and to offer ongoing psychological support, addressing concerns and anxieties that patients may experience as they transition from active treatment to survivorship. Now, you might be wondering, how is surveillance structured? Most guidelines, such as those from leading oncology societies, agree on a similar approach, particularly for individuals with higher-risk stage 2 or stage 3 colon cancer. The intensity and frequency of follow-up are tailored to individual risk and medical history, but the central components are consistent. Let us break down the main steps, without overwhelming you with numbers and complex schedules. Typically, after surgery, patients see their medical team for regular history and physical examinations. These visits occur every few months for the first 3 years, during which the risk of cancer returning is highest, and then become less frequent as time passes. Blood testing for a protein known as carcinoembryonic antigen is another pillar of surveillance. This protein can be shed by colon cancer cells. Rather than focusing on a single test result, doctors look for trends over time. A steady rise in this protein can signal a need for further investigation, sometimes before anything is visible on imaging. Advanced imaging studies, such as computed tomography scans of the chest, abdomen, and pelvis, are conducted annually for several years. These scans are invaluable for spotting hidden recurrences, especially in common sites like the liver and lungs. The goal is always to find new or returning cancer as early as possible, when treatment has the best chance of success. No surveillance program is complete without colonoscopy. This procedure, which allows doctors to visually inspect the inside of the colon, is usually performed 1 year after surgery. If no new concerns are found, future procedures are spaced further apart, but they remain a cornerstone for detecting new polyps or cancers early. For individuals with hereditary cancer syndromes, such as Lynch syndrome, colonoscopies are scheduled even more frequently due to the higher lifetime risk. So, what happens if something unusual turns up during surveillance? Imagine the scenario: a patient's blood test shows a rising carcinoembryonic antigen level, but their imaging scans still look normal. In such cases, a more sensitive test, such as positron emission tomography combined with computed tomography, may be used to search for very small, metabolically active tumors. If a recurrence is found, perhaps in a localized area or limited to the liver or lungs, a multidisciplinary team will come together to create a treatment plan. This may include additional surgery to remove the new tumor, ablation therapies, highly focused radiation, or sometimes chemotherapy to shrink the tumor before attempting a more aggressive intervention. Another important element is the ongoing conversation between doctors and patients. The intensity of follow-up care is not one size fits all. It is shaped by patient preferences, overall health, and life circumstances. After 5 years, the risk of recurrence drops significantly, and the focus shifts to maintaining overall wellness and regular colonoscopies according to general guidelines. Surveillance appointments also offer a platform for reinforcing healthy lifestyle choices, such as good nutrition, regular physical activity, and smoking cessation, which are known to improve outcomes and quality of life. Finally, it is important to remember that clinical trials are constantly evaluating new ways to improve both treatment and surveillance. Patients should always feel empowered to ask their care team about opportunities to participate in such studies. To summarize, surveillance after surgery for colon cancer is a structured, evidence-based process designed to maximize the odds of long-term survival by catching any recurrence or new cancer as early as possible. Adhering to guideline-recommended follow-up care has been shown to substantially improve survival outcomes. Thank you for joining us for this in-depth exploration of post-surgical surveillance for colon cancer. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.